And I think, Matt, we were talking earlier on of doing it all through the chat bar so that we could control the meeting. But I think with the number that are here just now, I think if you want to speak, just put up your hand and we'll let you speak verbally instead of through the chat bar. Yes. Right. Well, are you with us, Heather? No, no answer.
I'm definitely here. Yeah.
Oh, you're there. Right.
And Heather Brandon McVeigh is also here.
Are there two Heathers? That might be confusing.
Oh, right. Yes. Heather Brannan McVeigh, are you with us? We can't see you.
Yeah, she gave us a thumbs up there, Chair.
Oh, did she?
Councillor
Right.
McVeigh, Cabran McVeigh, yeah.
Okay, I would like to welcome everybody to this special community board meeting, Kilsyth Community Board meeting, which has been called only to deal with the vaccination centres. I know there are probably many things that you would love to discuss with Heather and her team, but that's for another day. We'll only deal with the vaccination centres and etc. This is being live streamed, so no swearing, no bad language, no rude signs or anything at all. We're all very civilised, and no politics coming into it. I would like, first of all, to welcome our guests, and though I've been in touch with them, I've not actually met any of them until tonight. We've got Heather Knox, who's the Chief Executive of NHS Lanarkshire. Thank you, Heather, for coming. We have Dr. Jane Burns, who is a Medical Director. Good evening. We have Dr. Mark Russell, who is the Associate Medical Director, and we've had conversations in the past, Mark. And Calvin Brown, who is the Director of Communications. Right. Evening, Calvin. I saw you there, yeah, yes. So I must thank you all for giving up your time to come and discuss this serious matter with us. And hopefully we'll be able to come to some kind of conclusion tonight. Heather, or who would like to make the presentation?
So Mark's going to make Dr. Mark Russell's going to do the presentation, Mr. Craig. So if he wants to load that up now, then we'll go straight into that, if that's all right with yourselves.
Right, well, before we start, I tried for years to get everybody not to call me Mr. Craig. After donkey's years of people calling me Mr. Craig, so straight up front is Bill, end of story. Right.
Only Heather then.
Yeah. Right, okay. Over to you.
Thanks very much, Bill. Okay, so let me just see if I can share my screen here. Hopefully you're now all able to see that.
Yes.
Perfect. Okay. So firstly, it's always bad to start with an apology, but I'm going to do it anyway because there's a couple of people on the board this evening who have already seen much of this presentation. So apologies to Councillor Jones and Councillor Brandon McVeigh, but I'll run through this quite quickly. I don't want to impinge on time for questions, but for everybody else, I'm aware that things have changed fairly rapidly, and it's probably a good idea if we start this evening with, I suppose, just try to lay out where we currently are in the vaccination programme. So I think the first thing that I had wanted to pick up today was really just a bit of background and in terms of how COVID has affected Lanarkshire. And this slide shows you on more or less the same scale that the rates of COVID in Lanarkshire against the rest of Scotland. And I suppose that the take-home message for this is that for large parts of the last 4 or 5 months, Lanarkshire has been significantly worse affected with COVID than the rest of Scotland has been. This gives us a bit of an uphill battle in Lanarkshire because we have had the effects of COVID harder but also longer than many other health board areas. And in terms of coming out of COVID, it gives us more work to do in terms of recovery because there's a lot of ongoing COVID related work to be done. So we need to continue to provide support to our public health teams. And in fact, that's in some ways going to become more labour intensive as we get down to smaller numbers and there's more intensive and more highly skilled work required to try and stop small outbreaks or small clusters becoming much bigger outbreaks. There is the vaccination programme, which will continue for a number of months. We're also bringing things back to Lanarkshire, which have gone out of Lanarkshire. So Lanarkshire has been quite a heavy user of the Louisa Jordan to try and keep some of our planned care work ongoing. But the Louisa Jordan is scaling back at the moment, and certainly that element is disappearing. So that's something that's coming back to Lanarkshire. And at the same time, we're going to be starting off or scaling up services which have been paused or gone down in their capacity. And that's really all the services that everyone is used to normally receiving from the health service. So cancer services, cancer work has clearly carried on, but it's been challenging to meet some of the targets that we're normally very proud of meeting. Other planned care, whether that's operations for people with problems with their hips or their joints, or other elective surgery, has clearly been radically scaled back, and that's all going to have to be scaled up. And then much of the work that has gone on in primary care. Now, primary care has continued working over the last 12 months, but probably in quite a different way from we're used to. And some of that will probably stay. There have been some new innovations which it would be sensible to keep, but there are other services which people have not been receiving in the way that they're used to receiving, and there's a lot of work ongoing just now to bring that back to what people are used to. The other thing to say is, and this is not a slide about Lanarkshire, it's just about COVID generally, but it sets the scene for the vaccination programme really. And the bars to look at are firstly that second bar there, which on the right hand side you'll see 3 groups circled, and they're the people in the population over the age of 65. And you'll see then, if you look down the bars towards the bottom of the chart, although that proportion of the population is a very small number of the number of confirmed COVID cases, less than about 15%, there's a huge disproportionate burden there in terms of the number of deaths from COVID, and over 90% of the deaths from COVID are in that age group. So that really, I suppose, sets the scene for why the vaccination programme, not just in Lanarkshire, but in Scotland, is structured the way it is. And in terms of where we are just now, as of today, we passed 250,000 vaccines some point this morning, which has taken a huge effort on the part of a very big team. But it does mean that there's still about 750,000 vaccines still to go, because in Lanarkshire, to complete this programme, we'll have to roll out about 1 million vaccines, and that's a population of 540,000 adults, and so far the uptake has been more than 90%. So bearing in mind that all of the vaccinations that are currently licensed are going to require 2 doses, that's where we get to our 1 million vaccinations from. So there's 2 phases to this vaccination programme, and phase 1 is concentrating on that group of people that we've been talking about, those amber and red bars, the people in those groups, the people who are most at risk. Phase 2, which is the phase that we're now moving on to, is different because it's about enabling a return to normal life for all of us. So it's about vaccinating those people who are in the rest of that bar, who are much less likely to suffer the severe consequences of COVID in terms of severe illness or death, but who are being affected by everything that's happening over the last year. And in terms of where we are in the vaccination programme just now, over the last 24 hours or so, we've completed cohort 6. That happened over the weekend, actually. And we've moved over the last 24 hours onto cohort 7. So cohort 7 is that first group of people who are under the age of 65. And the completion over the weekend was also actually people who were under the age of 65, but they were unpaid carers and some of the people who we had left over from those who are in the at-risk group, people who have additional conditions under the age of 65. So essentially, we're now moving into this phase 2 of people who are younger, people who are much less likely to suffer the consequences of COVID, although clearly they still can. But who are also probably more mobile and part of our working population. So within this phase of the vaccination programme, this is where the rate of vaccination becomes really, really important. And this graphic will hopefully help to demonstrate why. So you'll see in the top 3 windows there, how quickly a virus can spread. Now, this is not specific to COVID. This is really true of all viruses that we vaccinate against. And the percentages that you see there vary from virus to virus. But the bottom line is that you reach a point where it is very, very difficult, once a vaccination programme has proceeded to a certain point, for COVID to spread within the community. You'll see in the bottom row, and particularly in the 2 right-hand boxes there, there's still plenty of blue dots in the population, but they're not being affected by COVID in the way that they were, on the top row. And that's because they've got a shield around them of other people who already have been vaccinated. So we are entering this phase 2. We're into this lower risk population who are more mobile, who are going to want more choice around time, and who are going to want more flexibility from that point of view. And this is the part of the population where speed becomes really important, because we're trying to protect all of us, not just those who are being actively vaccinated at any one time. So the volume of vaccines is crucial. And we're obviously going to talk about a change in approach this evening. And the first thing to flag up is that the primary reason for that change in approach is to complete the vaccination programme as quickly as possible. And we're currently projecting that with that change in approach, we should manage to complete the vaccination programme at least 2 months sooner than we would have done otherwise under the previous model. And that brings with it a bunch of other benefits. And the first one to mention there is reducing the chance of new variants. So this is something that all of the boards in Scotland at the moment are having to do, and to look at how we consolidate, because there is obviously this increasing concern about new variants springing up during the vaccination programme, which in some circumstances might force you to go back to the start of the vaccination programme and start again. And that's clearly the last thing that we want to happen. But there's a couple of other things which make a case for change here on top of that. One is responding to a really variable supply in vaccines. Now, this was an issue day 1 back in December, but it's actually as much of an issue right now. And I suppose that is one of the surprises of the vaccination programme, that in general, you expect things to even out as time goes on. And that really hasn't happened. To give some context for this week that we're in just now, if you'd asked me a fortnight ago how many people would be vaccinating, I would probably have said round about 25 or 28,000 people. This week, we plan to vaccinate now somewhere in the region of 45 to 50,000 people. So it's changing that quickly, and we're having to respond to it, and we're having to have that ability to put on extra clinics. And conversely, in a few weeks' time, we will be that there's a contraction in supply, and we then have to be able to scale back really quickly. And that was something that was almost impossible to do under our previous model, because we had this rolling series of satellite clinics which rolled over several weeks. And that made scaling up and scaling down to match the vaccine supply very, very challenging. And as we get into second doses, I would say that it is impossible at that point, because it's just not possible to make sure that you have all the vaccines in the right place at the right time. And the last thing to mention, I suppose, is the effect that the first few weeks of the vaccination programme had on the rest of the health service. So we have used over 1,000 staff now within the vaccination programme. And during that concentrated period where we were targeting the 70 to 80-year-olds and tried to do it really quite quickly at that point, we had to redeploy 200 staff from the rest of the health service. And when I say 200 staff, I mean 200 nurses, primarily from other services. Now, that's a big draw on the rest of the health service within Lanarkshire, and it's not something that's sustainable. It's not something that will be able to continue to offer the care that people are expecting, and rightly so, and carry on having that draw as well. So there is a change here, which is now in process, essentially. Fewer bigger centres, but that does bring a benefit to patients as well. And it brings several benefits. The first one is about supervision. So we need to have senior staff within these centres, and that's something that we really struggled with when we were running 21 different centres, because it just wasn't possible to have senior staff on site in every one of them all the time. And that causes difficulties once you have somebody whose medical history is more complex and so on, because it led to a reasonable number of people being asked to come back or waiting for phone calls and so on to advise them whether they could be vaccinated or not. It also allows more physical room within bigger centres, so more space for distancing, more space for safe queuing if queues do start to emerge, and it allows greater ability for flexibility in terms of rebooking and time and when people want to choose to get their vaccination. But it is important to say in all of this that we want to ensure that no one is left behind in this programme, and this is not our last word by any manner of means. This is the next step, I suppose, that we're taking to accelerate the programme. But we are rolling out, partly because of some of the efficiencies that are coming with this changed way of working, specific programmes around, for example, at the moment, people with learning difficulties, and putting in place mechanisms for them to be vaccinated outside larger vaccination facilities, which might be really challenging for them to be vaccinated in. And on top of that, we've got a targeted mop-up campaign that will be starting shortly. And that will be driven by some data which we're now collecting on where vaccination rates are highest and where they're less high. And that might be geographical, it might be specific communities which are more deprived. That's what we're starting to look at just now and how that can be targeted. So I think this is probably something that will probably be familiar to people just now, but it's worthwhile dwelling for a moment on the model for the coming weeks, and also specifically as to why we've gone down the road of this model. So we have the two super centres, which are pretty centrally located within Lanarkshire, but clearly not particularly convenient for Kilsyth. And the reason that we have those two super centres and only those two is simply a matter of scale and the facilities that are available. So we did, when we were looking at this change in model 2-3 weeks ago, we looked at whether there were any other facilities elsewhere within Lanarkshire, specifically further north within Lanarkshire, that we could use either instead of or as well as these facilities. And we can come on to the specifics of some of the local facilities within Kilsyth and within Cumbernauld later on, I'm sure we will. But just for context here, the Muirfield Centre runs 6 vaccination lanes fairly comfortably, and 8, and it's a wee bit of a squeeze. Ravenscraig today is running 36 lanes, and Alistair McCoist's Nice Bride is running 22, I think. And it will comfortably run 24, and Ravenscraig could run 50 if you wanted. So there is that difference in scale there, and that causes us a real challenge, because to vaccinate at the rate that Ravenscraig and Alistair McCoist are currently vaccinating, you physically couldn't actually push the population of Cumbernauld and Kilsyth through Muirfield at the same rate. There's just not physically the space. So that pushed us down the road into this model of saying it's not really ideal from a geographical point of view, but we've got these two really large facilities. So we then have to have options for people who can't travel to them. And we've talked about the other 7 local centres which are dotted about, the nearest of which for Kilsyth residents will be the Muirfield Centre in Cumbernauld. But we've also started to look at some mobile centres as well. And there's a couple of options there in terms of ambulances, which have been used for vaccination, which we're using just now, and also an option around the Scottish Ambulance Service and some buses that they're piloting. The important thing to say is that there is a real efficiency difference in terms of these different ways of vaccinating. If you want to deliver 100 vaccinations, that requires 4 hours of time, of registered staff time. So nurse, doctor, optometrist, dentist, we've got a variety of different professions working there within a super centre. That doubles once you go into the local centres. Once you go down to mobile centres, it more than doubles, almost trebles again. And once you get down to delivering vaccinations in people's own homes, then you can see there how much staff time that takes. And that's simply down to things like travel time and ensuring people are okay within their own homes. And I think the important piece of context here to all of this is we only have the staff group that we have. There is a requirement for registered staff to be present for the delivery of these vaccinations. So nurses, dentists, doctors, whoever. And that's not something that we can go out and recruit more of. There's a fixed number of these staff within the health service. So if we have them working within the vaccination programme, then they are not doing something else and they're not providing a service that you would also expect to be provided. So in terms of how all of this will work, people under the age of 65 who are now being vaccinated will now receive an appointment for the super centre. We've done some work with colleagues on clarifying the letter text, because I think it's fair to say that previously it wasn't clear, and we've started to get some positive feedback of some of the changes that have been made. And the ask essentially there is that you attend the appointment in the super centre if you can get to it. If you can't get to it, there's a few options. So the national helpline can rebook people into local centres, and you can now also rebook online via the online portal, which is now available, and details of that are contained in the letter. We have an expanded help desk as well, but one of the things that we've been working on over the last week is, rather than people having to follow a multi-stage process to look at transport options, of moving transport options out of this. And we've worked directly with SPT on this. So our arrangement now, this is an arrangement we'll be publicising over the next couple of days, is that anybody who needs transport advice should go directly to Travelline. And Travelline then have a variety of options in terms of, firstly, looking at scheduled transport options, and that would include the shuttles, which have now been set up between Cumbernauld and Ravenscraig, and also between Motherwell and Ravenscraig, but other scheduled transport options. Then also looking at other transport options such as MyBus for more local travel, and then finally community transport providers. So many of our third sector partners have become involved in providing this. So there are a variety of options there. And I suppose the last thing which we're still looking at just now, because it's a bit more complex and is really designed for this mop-up phase and a targeted mop-up phase, is around transport vouchers as well, because we realise that there are barriers, financial barriers, to people even travelling to the local centres. So that's something that we're looking with some of our transport partners with just now, and that's an additional added extra, I suppose, that we've started looking at over the last 10 days or so. That's particularly complex because Lanarkshire has a very high number of bus operators within it. So there's a significant amount of negotiation to do and getting agreement from all of those bus operators for that to be viable. So I suppose that the last thing here is the general ask and our general message, I suppose, tonight. And that's around a few things here. Firstly, that acknowledgement that we need to accelerate the vaccination programme, and an acknowledgement of the fact that the fastest way to do this is through the super centres, and we would encourage everybody in the community who can attend there to attend there. But we know that that's not going to be everybody, so we are trying to provide a range of transport options. And really the key messages here is this helps everything to return to normal faster. It gets the world that we live in back to normal, probably a couple of months earlier than it would do otherwise, but also gets our health services back to normal otherwise. And I suppose the last message, and really the reason for being here this evening, is to put across the message that this is definitely not the end of the story here, that we are here to listen tonight, and there will be further stages to this process. And we want to ensure that as much as we can, that we meet communities' needs in that. Thanks, Bill.
Thank you very much, Mark. Some interesting things in that presentation. And I fully understand and appreciate the problems you've got and how you're trying to deal with this. But it still affects the community within our area and the villages. So I'm not going to take up any of the question time. Has anybody got any questions that they want to ask Mark or any member of the team? Alan.
Right, thanks very much, Bill. Can you hear me?
Yeah,
I'm
we
just
can hear you fine.
Yes.
Yes, okay. The problem with the microphone in this. Thanks very much, Dr. Russell. Fully appreciate where you're coming from with this, with your presentation. But very typically of this whole thing, even when you showed the map of Lanarkshire, didn't quite get Kilsyth into it. And this is always the problem here, that we feel to some extent very much out in a limb. Now, I've been looking up the various transport links like SPT, Case, Van El, etc. And I'm not sure how on earth you can cope with demand if a lot of people want to get to Ravenscraig for a whole range of times. How on earth is it possible to accomplish this with the bus services as you're describing them?
So I think that's a fair point. I think what we have to look at is that we're not necessarily trying to accommodate everybody with a bus service. So that's thing number one. We know that 70% of households in the northern part of North Lanarkshire have a car within their household. So you've got 30% clearly who don't. And when we've done research within Lanarkshire previously for emergency care purposes, the people have told us in surveys that around about 4 or 5% of people don't have access to a car, full stop. So, if you ask people, can you get to GP out of hours and so on within the North Lanarkshire area, 95% of people can. And I think it's really about how we look at the population. So most people are going to be able to get there. And we know that even when we were talking about local centres, those were the kind of orders of magnitude that we were talking about. 95% of people were turning up in a car. Car sharing is allowable in these circumstances. This is essential travel. So similarly to the use of public transport and so on, while people are not being encouraged to do that in other circumstances, this is the most important journey that people will make this year. And at the end of the day, I would like to be able to deliver this vaccination campaign from the word go to the end of it in the way that people would be used to having a flu vaccination campaign delivered, in the past, where it was very local, where you maybe went down to your GP or to a community health centre or community centre. But the numbers here are, what stand in our way. So to give context about this year was the highest uptake we've ever had in Lanarkshire or Scotland in general for the flu vaccination campaign. We vaccinated 240,000 people. And what that meant was that over about 10, 12 weeks, we were vaccinating roughly 20,000 people a week. We, as I say, will be vaccinating 50,000 people a week this week. And I would say it's highly likely over the coming weeks that we'll probably hit 60 to 70,000 people in some weeks. So the scale is just completely different. And yet we're trying to do this with the same group of staff that we would usually do it. Now, we've changed our ways of working, but there are limitations in terms of the efficiencies that you can wring out of this. And two things then, you just can't go to as many venues because you have to get the economies of scale to deliver it as quickly as we need to, or we'll be here in another 9 months' time, still delivering the COVID vaccination programme. And on top of that, many of the venues which we would customarily use for things like flu vaccinations and so on are simply just not big enough to cope with the rate of people that you would need to push through them if you were going to do it in a very local way. And I know that that's challenging for communities, communities like Kilsyth, there's other places in North Lanarkshire, places like Shotts, and then clearly large parts of South Lanarkshire, which are more rural as well. I totally get that this model is challenging for those areas. I think the important thing to say is that this is not a signal. This is how vaccinations will be done, from now on. This is about a particular point in time where, we are being expected, and rightly so, to deliver, 250,000 vaccinations potentially in a month. Now, that's a scale which we have never had to do before, and in all honesty, I hope we never have to do again. But it's the right thing to do just now, because that's how we get the world back to normal, and how by the time it comes to summer, we can all be starting to get the things back that we need to be getting back. And more importantly, that we prevent further illness and further death within our communities.
Thanks very much, Mark and Alan. Jean?
Thanks very much, Mark. And on Friday, we discussed people phoning on Friday morning, they couldn't get an appointment in Muirfield. But by Friday night, it was funny, there was loads and loads of appointments for Muirfield after having that discussion with you. And that's concerned me, because that's what we went through here in Kilsyth with the Garrel Vale. People were phoning up, no appointments, and then lo and behold, there were appointments. But that aside, today I've had 2 phone calls about people going to one going to Ravenscraig. The person left Queensy Burn, got a bus from Queensy Burn to Kilsyth, a bus from Kilsyth to Cumbernauld, and by the time they got there, they seen the back of the Ravenscraig bus going. 45 minutes waiting a bus. Got the bus to Ravenscraig. The staff in Ravenscraig, I was told, were absolutely fantastic. Understood why they were late, got them in, and they still got their vaccination. And again, as I keep on saying, the staff that are delivering and the frontline staff delivering are getting it right. The PR we're getting back from that is fantastic. So then, lo and behold, they come back, and it took them another 3 hours to go home. 6.5 hours it took them to go to get their vaccination. That's really not acceptable. And we need, if you're expecting people from this area to go, you need to bring the bus down to Kilsyth as well. I'm sorry. Another person phoned me and said, you've got a bus to Ravenscraig from Cumbernauld. I live in Cumbernauld, that's great, but I've been given an appointment at Ali McCoy Centre and I can't get it changed to Ravenscraig. So we're not getting it right still. We need to get it right for our communities. I represent Kilsyth and villages, and maybe I'm going on here and I'm saying, well, to hang with the rest of the North Lanarkshire, but I need to get it right for the people in this community. This community wants to get back on its feet, get the businesses opened and get everything opened in our community, but we can't do it without the vaccine. People want the vaccine but can't get it. So I just find it unacceptable, 6.5 hours to get to there.
Okay. I think Heather wanted to come in on this, Phil.
I think Heather wants to come in there.
So I was going to come in on the scheduling point that you made, but and then maybe bring Mark in on the transport point. We had a conversation with the national scheduling team on Friday, Jean. Is it all right if I call you Jean? Had a conversation with them last Friday afternoon.
So yes, no problem.
Okay, and what we discovered was, because we couldn't understand why people were not managing to get slots, because we had loaded up the clinics for Muirfield and people were still saying, like you were saying, their experience on Friday was they were phoning through and not being able to get booked into the local centre. We knew there was capacity there. What we discovered was, and it's been fixed, but what we discovered was, because the Muirfield Centre is not open every day of the week, it's open maybe, so next week I think it's open Thursday, Friday, isn't it, Mark? My memory serves me rightly. And we'll publish these dates. That's something else we will do. People were going in, the operator was going in Monday, nothing, Tuesday, nothing, Wednesday, nothing, and stopped at Wednesday. And then they were saying there was nothing. So what we've done is we've put in place a system whereby there's an electronic A bit like, I don't know if you've ever gone in to book seats for a pantomime or a concert or something online, and you can see at a glance the seats that are available. So they've now done that for us with the call handlers. So call handlers will actually be able to see that there are slots on the Thursday and the Friday. So hopefully that particular problem has been fixed following that conversation on Friday afternoon. But I'll bring in Mark to talk about the transport options and the links into the travel line people. Mark, do you want to respond to these points?
Yes, absolutely. So I think it's really difficult, and I understand where you're coming from in terms of the length of the journey there. Pretty tiring journey if you're having to travel for 6 hours, and extremely frustrating if you see the back of a departing bus. I suppose what I would like to get from you tonight, and you've given us some of this, is what you think we can do to help to fix this. So, bringing a bus to every community would be one thing. But as I suppose I've said, there's a variety of communities who, to be honest, are going to be in the same position here. And there is a trade-off for us between the I don't want to say convenience, because I realise it's more than inconvenience that we're talking about here, but the difficulties that people are experiencing and the speed, through which we can do vaccination. So that was one of the conversations. We had two conversations on Friday afternoon after the councillors' meeting. One was the one that Heather's just described with our national colleagues, and the other was the one through SPT. That was a really helpful conversation, to be honest, because I think one of the things that we've done up till now is to rely on the national helpline to do everything for us. And I think it became clear, in the meeting that we had, with yourselves in the North Lanarkshire councillors and subsequently the South Lanarkshire councillors on Friday afternoon, was that the national helpline really wasn't managing to fulfil all of those, functions. Now, that's no criticism on them. As I said on Friday, they have 1,000 new call handlers who had a totally different job 6 weeks ago. They've had to scale really quickly as well. But there is a question there about, were we asking too much of them? Were we asking too much to handle your local options for 12 boards and transport and so on as well? And I think the answer to that is yes. So the conversation that we had with some of our colleagues at SPT was around using Travel Line for this. And using Travel Line in a way of actually asking them to put together the best journey for people. And if that journey is excessive, to then look at what other options might be available. So my bus and similar options are a potential option there. And when we get further down the line, if for one reason or another that isn't an option, then we do have the community transport providers as well. Now, I'm not going to turn around and say that I can put in a door-to-door service for everybody in Kilsyth to Ravenscraig, because I can't do that, because we then have to do it for Shotts and Salisbury and a variety of other places as well out of equity. And I just don't think that would be practical, to be perfectly honest. I don't think we'd have the number of buses to do it, to put in that level of bespoke service. But I think we do have to try and address some of these things. And there is something about encouraging people to actually phone Travel Line and to make use of the service that's there, particularly if on the first look at the timetables themselves, it is going to take them, a 6-hour round trip, because there are other options there. And Travel Line have said that they are more than happy to take responsibility for working with us on that. And the other thing that they're going to do is to look at what's coming into them and to put in place some options for them to essentially analyse the requests that they're getting in, so that we can then draw on the data that they gather. And if we find that we're having to put in bespoke options, my bus or whatever, for a significant number of people in a particular area, then that's where it does become more worthwhile for them to then look at whether it's redirection of scheduled services, because they've done some of that close to Ravenscraig, but we can look to do that in other areas too, further away. But we need to make sure that we're targeting the right places. This is a big programme, and it is therefore worthwhile for us to look for a period of a few months here at what we can do about actually repivoting the transport options that are available within Lanarkshire. but we need some data on that. And people have to give us that data, really, I suppose, is what I'm saying, by picking up the phone and speaking to Travel Line and trying to help us to sort out the options for them.
Right, Mark, thanks very much. Alan?
I'm just going to ask for a supplementary bus.
Okay, I'll come back to you, Jean.
Okay. Okay, one of the problems we've always had here is the fact that Kilsyth was never ever designed to have a north-south transport system. Our main links have always been east-west, towards Glasgow and towards Stirling. Is there any possibility of having some kind of option whereby the community who need easier travel arrangements could move towards the Glasgow end, for example, Kirkintilloch, rather than Ravenscraig, which is extremely difficult to access if you don't have your own own transport. Sorry. The other thing I was going to ask is, what is the no-show statistics like at Ravenscraig? Are a lot of people not turning up for their appointments?
So I'll maybe address that point, and then I brushed over something that would have addressed some of the other part of your question, but I'll maybe get Heather to pick up on that in a wee second, if that's okay. So we've been looking at this over the last few days, and obviously we've only got a few days worth of data to go on here. The well, it's not a no-show rate yesterday, but if you compare the original number of people who were originally booked into Ravenscraig yesterday with the actual number who were vaccinated, 86% of people who were originally scheduled in were vaccinated yesterday. Now, that doesn't mean that 14% didn't turn up. A reasonable proportion of them have already rebooked elsewhere, and another reasonable proportion have rebooked for Ravenscraig, or potentially for Allymccoy, but have rebooked for a different date. That's pretty normal for us, to be honest. So the rates that we've had have varied centre to centre, but they've generally been somewhere in the region of about 84 to about 90% in terms of the number of people that we capture on any given day compared to the number of people that we book in. So I don't think there's a signal just now to suggest that there are there's going to be a difficulty here in terms of numbers of people. But clearly, for some of those people, they're going to have difficult journeys, and I would totally accept that. And we need to do everything that we can to minimise that difficulty. And also, I don't want to pretend that we don't, or to put across that we don't care about the 5 or 6% of people who up till now haven't been vaccinated, because we've had fantastic rates of vaccination, rates that we've never seen in any other vaccination programme ever. Every one of our cohorts up to this point has been 95% or above in Lanarkshire, and we're among the best in Scotland there just now. I want to maintain that, and I want to try and find out why the 5% in each of the cohorts who haven't been vaccinated, and to try and get them vaccinated. We want to get to 100%, if we can. I think we also have to be realistic, though, that as we go down through the age groups that we've been doing up till now are those who are clearly the most personally motivated to be vaccinated, because they're those most at risk. So we're expecting, once we get down into some of the younger age groups, that vaccination rate will drop. But even so, we've been doing some younger people at the end of last week in Ravenscraig, people who were in their teens and 20s even, who had some kind of other significant medical condition, and the attendance rates were, I have to say, a lot better than I expected, even for that group as well. So I think there are good signs about about people's willingness to travel, albeit that I accept that it's sometimes difficult for them to do that. But I don't know whether Heather wants to pick up the other points about accessibility elsewhere.
Yeah, no, that's fine. Thank you, Mark. And I suppose the thing to say before I answer that second part to your question, Alan, was just to say that we will look at uptake levels across the whole of Lanarkshire at the end, and if we think there are areas, so I think probably what you might have been getting at. You know, if a lot of people in Kilsyth haven't been vaccinated, will that show up and we'll monitor that? I suspect that's where you were looking to ask a question. So if that is the case, we'll come back in and do our clinics locally. We don't want to leave people behind. So we've pushed really hard to get everybody vaccinated. So just to give you that reassurance. The other part of your question was around whether we could work across health board boundaries. And we've had conversations with the NHS Forth Valley, certainly, and they would be open to an arrangement whereby people from Cumbernauld, Kilsyth area went across to Forth Valley for vaccination. And I think that's something that we could make happen relatively easily. I'm not sure how often Kirkintilloch is open. That was the question I needed to go back and get answered from Glasgow. Mark, you had conversations with Glasgow about whether we could do something with Glasgow Health Board, and I suspect Kirkintilloch might have been the nearest place. I don't know in terms of access. So again, if that's something that's of interest, we could go back and push that more. But the Forth Valley one, we were knocking at an open door. They were happy to do it. So is that something you would want us to put in place, Alan?
Right. Thanks very much, Heather and Mark. Our Heather Brannan McVeigh.
Thank you very much, Bill. Can I start, before I make any comment, just to say I sincerely thank every member of staff who's working on the vaccination programme. Every single one of us knows how vital this is to our families, our communities and our wider world till it was to open again. So don't I was interested to equity framing versus shots an approach. And this equity issue for the people of the most northerly part of North Lanarkshire and access a Lanarkshire. Sorry, I hope you can still hear me. So the concern that I have is we're scheduling appointments at Ravenscraig, and it's not just the logistics of travel that are difficult there, it's also the anxiety of travelling to somewhere that you're unfamiliar with. We rarely travel from Kilsyth to Motherwell for any service. Before I was an elected member, I'd probably been to Motherwell 2 or 3 times in my whole life. But for me, going to Motherwell is an accessible thing because I can jump in the car, jump in the motorway. The approach that the health boards have taken here has really divided our community into 2 groups: the have and the have-nots. They have transport and they have not have access to transport, and that concerns me because that also means that it's about those who are able to access the transport, can afford to have transport. And if you can't afford to have transport, chances are you're living your life in more disadvantage, which means you're potentially at more risk of this horrible virus too. Which takes me to my question about risk versus benefit of population migration to a central location. How do you monitor buses to make sure that they're not overly full? How do you schedule appointments to make sure that not everyone from the same street is or is not accessing the vaccination centre? What is the delay time of the rebook from refusing to go to Ravenscraig to accessing Muirfield or another venue? Because I'm concerned that some people may have had first vaccines. How will this knock into the timescale available to them for the second? And another question that I have is, fantastic that you say you're on to priority group 7. I'm aware of multiple people in priority group 6, 5, 4 and 3 who are saying that they've been missed. And there seems to be a data problem between NHS national, NHS local, and being able to have those contact details correct for people to be invited to a vaccination in a priority group that they believe that they're in. So a number of questions there, Bill, I appreciate, but I was scared my signal went.
Thank you, Heather. Who's going to pick that up?
Shall I start and we can pass it around? So haves and have-nots, I think that's a really difficult one, and it's one I would acknowledge here. I think it's, we started off with an equality impact assessment, as you do with any new programme, and even at that point, when we were looking at a relatively local approach within Lanarkshire, we were aware of the impact of that. It's one of the things which has occupied our minds here, and I need to be totally honest, if we could deliver this in a localised way, without having an impact on the rest of services, and more importantly, I think deliver it as fast as we are being rightfully expected to deliver it, I think that would be the easiest way to minimise some of the downsides that you're talking about there. And I think we need to work harder, and my colleagues are doing that now in terms of ensuring that accessibility. So I think, I'm not saying this is the solution to everything, but things like a travel voucher scheme and so on may well be helpful there. And particularly, around that we need to make that accessible. So we need to make sure that there's not a multi-step process that people have to follow to get their travel voucher. So that's why that's taken a wee bit of time, because not only do we have to work with the bus operators, we also have to work with our national colleagues to make sure that it comes out with the letter when that letter drops through the letterbox. One of the criticisms, which I think was rightly applied at the meeting with councillors on Friday, is would it not have been better to have all of this in place at the outset? Absolutely, it would have been. But at the same time, we would then, during that period of several weeks that it would have taken to have the things in place and to publicise them properly, we would have been falling behind in terms of vaccinations, and we would have been falling behind protecting our communities. But I think our programme focus here has very much moved over the last couple of weeks onto that equalities impact assessment and looking at that mop-up campaign as well, and about how we can then move, once we've moved through these groups, how we can double back on ourselves essentially and look to mop up in areas. That is more resource intensive, but if you can then target that on specific areas. And I'm sorry if it came across as if I am playing one area off against another. That's the last thing I would want to do here. There's a reality that Kilsyth is out on the edge of Lanarkshire. I totally accept that, and that therefore we need to take particular account of that. And I think we are specifically trying, in terms of both Cumbernauld and Kilsyth, to look for a variety of different options. No one of these options is going to solve the problems here, but we hope that if we put together a package of these options in terms of looking at communications with other boards, looking at cross-boundary access, in terms of bus support, in terms of voucher schemes and so on, and put all of these things together, that they'll address both the equity and also the accessibility side of things here. In terms of delay time, there's no artificial delay here. So, we're not going to turn around and say you have to wait 3 weeks, before you're allowed to go to, to a centre. It is a capacity issue, in all honesty. So we need to get Ravenscraig and Allymccoist up and running. That comes with a different set of complexities to the ones we've been dealing with for the last 6 weeks or so. We're no longer running 21 corner shops, but we're now running 2 supermarkets instead. And that comes with a different set of issues. So we need to give our staff a little bit of time to bed in, and that's the reason for the gap before we do open the local options next week. But once they're opened, then we'll continue doing that on a rolling basis. What we can't do right now is turn around and say to you through to the end of May, say, here are the dates that, that these centres will be open. And that's for a very simple reason. We don't know what the vaccine supply is going to be like. So what we can't do is book things well ahead of time at the moment, because the vaccine supply is so variable. And the last thing we want to do is to commit to vaccinate people on a given date and then have to pull the rug under, from under them a week or so before that and say, well, actually, sorry, we're not going to have the vaccine to do that. You're going to have to wait. That's happened in other parts of Scotland, and it's really something that we want to avoid. So it will be a rolling programme, but as Heather said, we'll make these, they're not a secret. We will be transparent about these dates and we'll publish them as we go. In terms of the data problem, so I think it's become clear that there is an issue, and I don't think anyone's totally certain where it is. This is one of these processes which involves computers, which should be foolproof, and never is. So the way that this process happens, there's actually not really very much local involvement in it at all. We put on the clinics onto something called NVSS, National Vaccination Scheduling System. And then there's a team nationally who pull data out from a database called CAI. But basically, you can think of that as an attachment to your GP surgery database. So if you've got a GP surgery somewhere in Lanarkshire and surrounding area, the data should flow through there. There are a bunch of complexities though, and I understand some of the issues around cohort 6 and whether people are qualifying, as it were, for cohort 6. That's a fairly complex issue, and if we've got time, I'm happy to talk more about that. What is perplexing is a little bit more, if I'm being totally honest, is some of the issues around the other age-related cohorts, which should be pretty straightforward to schedule. Some of that was around, in some areas of Scotland, boundaries, where some people were being scheduled into GP surgeries, other people were being scheduled by health boards, depending on which board they were resident in. But that really shouldn't. We've checked it out with Forth Valley and with Greater Glasgow and Clyde, and we've been in sync in that point. There is a portal, which people can go online and log the fact they haven't received an appointment. But I think our national team have acknowledged over the last couple of days that hasn't really been working as well either, as it should have been. And they've pulled in some of the learning from that into the carers portal, which opened on Monday, but then added back the additional technology that they've developed for that into that. And they were telling us earlier on today that they've refreshed that over the last 48 hours, so that if people are now going on, and whether it's through the phone line or whether it's through the portal themselves, and saying that their cohort's been passed through and they still haven't received an appointment, they'll be much better updated. Because one of the complaints was that it was like a black hole, that people were putting their details in and then they were hearing nothing back. And 5 to 7 days is a long time at the moment when people are waiting for a vaccination appointment. So they put in place the ability to take phone numbers, take email addresses from people, so that people could receive communication through the process of saying, right, okay, your details have now been matched, we've found you. We've now passed your details on to the health board. The health board will schedule you. You should receive a vaccination appointment within another 72 to 3 to 4 days, essentially, is the timescale they're setting. So I think that will improve. I think there's further investigations going on nationally as to why that's happened in the first place. And I think it's comparatively relatively small numbers of people, but it really matters to those people. So we've vaccinated 250,000 people in Lanarkshire. We're now past 2 million or so nationally. And the numbers of people that we're dealing with missed appointments here are in the low thousands, but we're hearing about all of them. So it's a very small proportion, but it clearly really matters to each of those people who haven't got an appointment, and we need to fix that. I think Heather was going to come back in.
Jane,
okay.
Jane was coming in. Is that something about what Councillor Brannan McVeigh was talking about?
Yes,
right.
Thanks, Phil. I'm happy to pick up on some of that.
Right, Jean. On you go.
Okay, can you hear me?
Yes.
Okay, thank you. So I just wanted to pick up on what Councillor Brannan McVeigh said about the haves and the have-nots, because I think it's one of the key messages that has emerged through this pandemic, and is to have spotlighted the health inequalities and the fact that our poorer, more deprived communities, the individuals living within them, are at much higher risk from the vaccine. So these are communities that we desperately need to reach. And Mark said at the outset, we need to reach levels of population vaccination in excess of 90%. We can't do that if we don't reach those hard-to-reach communities. And we know that they're already very hard-to-reach communities in terms of their access to all kinds of healthcare facilities and other facilities that are more readily utilised by other people. So we really do need to find ways to target those individuals. I think that what Mark had said earlier in his presentation, he spoke about phase 1 and phase 2. He didn't touch on phase 3 and phase 4, but there will be a phase 3 and a phase 4, and maybe more than that, and then eventually we'll get to business as usual. The reason we haven't explained to you what phase 3 and phase 4 need to look like is because we haven't worked that out yet, and it will take us time. And further engagement with you about how to identify the best possible ways to engage with those hard to reach communities. So we're very, very mindful of that there's still much more work to be done round about that. So I really just wanted to emphasise that again, and also that if people feel that they've been missed from the cohorts that have gone already, as Mark said, there is a portal to be able to help with that and find out why that has happened, so that we can try and fix it, but also so that those individuals get an appropriate date for their vaccination as well. So I think those were really the key points that I wanted to pick up on. In terms of the buses not being overfilled, I think we have to work with our colleagues in SBT to make sure that they've got the appropriate guidance in place and that they do not allow their buses to be overfilled. But that also means that they need to stay in regular communication with us if there isn't adequate transport laid on. Thanks.
Thank you, Jane. Heather, you wanted to come in there.
So it's just, I think one of the points that Heather made was about second vaccine doses. So people will have their second vaccine normally in the same place as they had their first one. That would be the normal practice within this vaccination programme. But one of the things that we are a bit restricted by, and Jane might want to come back in on this one, is how we can and can't use Pfizer vaccine. And we've got quite a lot of Pfizer vaccine available, which means that we do have to use the bigger centres for that reason as well. And I might bring Jane in just to say a few words about vaccine storage and how that will work in the big centres. And then I wondered if Calvin wanted to say a wee bit about how we will communicate the dates that Muirfield is open, and we might actually be asking you for some help with that, communicating those dates with your local communities for those people who really can't travel any further than Muirfield. So can I maybe bring in Jane first of all to say a bit about the second doses and Pfizer vaccine, and then Calvin, if that's all right with yourself, Bill?
Thanks, Heather. I'm happy to pick up on that. So the second doses of vaccine, first of all, for the most vulnerable groups within the population, we'll use the same routes as we have done. So we have a separate facility, obviously, for vaccinating those who are housebound, and we will continue to use that team for second doses for that cohort of individuals. For those patients over the age of 80, that the route that we used for first doses was through the general practitioners, and we will use that for second doses as well. We will aim to try and keep the over 70s as local as we possibly can, and hopefully by the time that we get to that cohort, we will have done a sizable percentage of the other younger cohorts and freed up some capacity to do that. With respect to the Pfizer vaccine and the complexities of dealing with it, is that because it needs to be kept in such deep cold storage, right up to the point just before it's ready to be delivered, it's not every facility that can manage that. So that's one point about it, and it's quite difficult to disperse it across the county. But also, if you've had the Pfizer vaccine, the slightly higher number of individuals have had an allergic reaction to the Pfizer vaccine. That type of allergic reaction is more common with the second dose of any medicine than with the first dose. And so what we have to do when we do administer the Pfizer vaccine is that we have to make sure that individuals can sit or, if necessary, lie down in a socially distanced environment for at least 15 minutes after they've had the vaccine. So that actually takes up quite a significant amount of capacity in order to provide that. So there are some other challenges around the use of the Pfizer vaccine that don't exist for the AstraZeneca vaccine. I hope that picks up those points that Heather wanted me to clear.
Thank you, Jane. Calvin.
Yeah, thank you, Bill. Yeah, just a few points around about communication that we're doing this week and over the coming weeks that might help. One is we're doing a simplified transport and rebooking guide. So that will hopefully give people really easy, clear steps to how they would tackle the problem of I can't get to my appointment at Ravenscraig or East Kilbride. In addition to that, we will, as soon as confirmed, publicise dates for Muirfield. So we'll do that through our website, but we'll share that with yourselves as well, with elected members, and through social media. So that information will be then available. And I think in conjunction with the step-by-step guide round about transport and rebooking, that should help people get easier access to local options where they require them, or transport support if that's preferable.
Thanks, Calvin. Jean. Right, Jean, you've been waiting there very patiently for your supplementary question.
It was more a supplementary when I'd asked the question, because Mark went on about my bus. I hope you know that my bus, you need to be registered to be able to book my bus, because you need to meet a certain criteria for it, and it has not operated in Kilsyth for the last year, because I've already had to take that up with SPT on behalf of people who have registered and have been unable to use it. So you might want to go back to SPT on that one. Also, our SPT advising people if there's roadworks that they need to leave earlier for earlier buses, because we had a bit of an issue at the weekend there because of one of the roads out of Kilsyth was closed, and the amount of people that had an extra 15 minutes on their journey to get had that added onto their day. But again, you know, we're still sitting here, and again, one of the things that would help is if the bus get brought down to Kilsyth. I'm not asking you to take it out to all the villages. I think a central pickup in Kilsyth down across by the swimming pool would not add much onto the journey, and I think it's something we really need to seriously consider if you want people to take up the option of going to Ravenscraig. And I know what you're going to stand back and say, but other communities will want the same. I don't care what other communities want. I'm talking for the people of Kilsyth and villages right at this moment in time. That's what my initial role is within the council, to represent them. So therefore, anything I'm speaking about is to make sure that the community here in Kilsyth, the surrounding villages, can get easy access to get their vaccine, because virtually everybody I speak to is desperate to get their vaccine, but no everybody's taken up the first vaccine yet, who should have taken it up, because they're terrified of going in public transport, and more than one mode of public transport to get to the place. They would probably go in one bus, but they wouldn't go in 3 buses, which some people are having to do.
Thanks, Jean. Mark?
I'll happily pick that up. So I think it's important to say that we've had some discussions with SPT about bespoke arrangements, shall we say, not just for Lanarkshire, but in general in the west of Scotland around my bus, and the restrictions around my bus for vaccinations will not be the same as they would normally be. So they have given us reassurance about that point, and if you feel differently and you hear differently, that's something that I would want to know about, because they've given us a commitment there, and they've essentially given us a commitment to try and look to find something that's doable for everybody who contacts them. So understandably using the least resource intensive option for everybody. But for people who were looking at very substantial journeys by one mode of transport, moving down to a more resource intensive transport, I'll go back and ask them about the roadwork side of things, because I can't honestly answer that tonight. But I'm quite happy to take that back to them. And your last point, I suppose, was about diversion of the bus. That's again not something I'm going to promise tonight, because I don't want to say anything tonight that I can't deliver on. But I'll go back and talk to them about that. And if we can, if within the overall framework that we've got, if we can run that bus through Kilsyth without significantly extending journey times, then absolutely we can look at that. And if it's well utilised, then absolutely we can do that. I'll need to go away and look at them and see what the consequences, what the broader consequences would be. And I totally take on board, what you say about your local representative function. But at the same time, we need to view this even from the Cumbernauld and Kilsyth point of view in the round, or I do, in terms of I'm going to be asking SPT, what are the consequences for everybody who's getting on the bus in Cumbernauld? You know, are we going to affect the service generally by doing this? But I'll absolutely go back and ask them that question. That's not a problem to do.
Right, thanks, Mark. Before I bring in Alan again, just on the buses, what Jean mentioned and you're talking about there, Mark, if the buses start in Kilsyth, they've all got to go through Cumbernauld to get to Motherwell. Whereas if they start in Cumbernauld, then they're missing out the whole of the Kilsyth and Ward 1 area. So maybe the base for starting should be Kilsyth, and then they can pick up passengers en route to Motherwell.
So that was what I had in mind, and that's the question I intend to ask them, Bill. The difficulty with that is that it will add journey time to the total journey, and what effectively that will do is will reduce the overall frequency of services across the day. So the bottom line is people will have to wait longer after their vaccination to get back. But we can look at that, and I can't tell you right now off the top of my head what the consequences would be there. It might be quite small, it may be quite large. We'll need to go back to the experts and ask them, you know, what the impact would be of doing that. And I'm quite happy to commit tonight to doing that.
The travel time is the same for people in Ward 1, Kilsyth area, and the villages, irrespective of whether they get the bus in Kilsyth or Cumbernauld. So if they leave their house, if I leave my house in Kilsyth to get the bus at the bottom of the hill and go at the swimming pool and go to Motherwell, that travel journey is exactly the same as it would be if I had to go and get a bus down to the bottom of the street, go to the bus terminus in Cumbernauld, pick up your bus and go to Motherwell. So the time scale from a Kilsyth person's point of view is exactly the same. Alan?
Yes, whatever solution, it must be simple and very clearly communicated. If you look up My Bus Cumbernauld, for example, you have to phone it on Thursday for Sunday, Friday for Monday, and if you have a problem and you want help, it suggests that you phone your GP surgery. Well, I don't think that's really the most efficient use of our GP surgeries. A whole thing about this is communication. We've had changes to the whole procedure. We've got this move to supercentres. Our community looks at our £6 million health centre and thinks, why can't we use this? Now, today you have, this evening you have put forward the whole principle of why you're using the supercentres, why this is enabling you to get through so many vaccinations. But the community don't understand that. And we've also got the problem of, if you're IT savvy, if you know how to get onto the NHS Lanarkshire website and check if there are changes, if you're confident with picking up the phone and phoning all these different agencies, that's fine. But if you're not, then it's a problem. And this is a worry. We're trying not to have anyone disadvantaged, but almost inevitably anything which deals through high-tech IT is going to disadvantage some part of the community.
Okay, Alan, any reactions? What?
Yeah, if I could come back in,
Yes,
I do completely agree with you, Alan, and it is one of the challenges. And I think in an ideal world, we've obviously got the appointment letters going out, and that's the place you would put all the information about travel and everything else. But because of the national nature of the way that the letter's going out, it has to work for every area. So we don't have the ability to tailor it and tailor the information to what we'd want for Lanarkshire, or even more local down to Kilsyth. So it is a frustration, but we have to work with that and try and plug the gaps through the other communications we're putting out, and hope that through word of mouth, reaching as many people through social media, the local media, through our website, through elected members, that the word will get out. Obviously, it's important that the information that people get when they phone up the helpline matches that, if that's the route that they take, and that's something that the team have been working very hard on.
Thanks very much, Calvin. Janet?
Yeah, just when Calvin's talking about communication, it has been touched on, but there is a valid point with people, the 30% that don't have access to their own vehicle, who are being encouraged to either car share or use public transport. That's now running counterintuitive to the message for the last 12 months, where they've been encouraged not to use public transport, not to car share unless it's a journey time of 15 minutes or less. So there's a whole group of people for whom that is a very mixed message, and they are exceptionally concerned and worried about it, that in that period of interacting with either a shared transport or public transport, that they might actually catch COVID before they even get to the vaccination. And that's a real worry for a lot of group of people.
Any comments?
Probably just to acknowledge that and say we'll try and best explain that as possible in our communications. I do think you're right, it is a mixed message when you tell people for that length of time not to do these things, and then you turn around and say yes, but it's okay to do it in this circumstance, because communicating risk and the fact that the risk of not taking that journey is far larger in this instance than the risk of taking that journey because of the benefit of the vaccine. These are difficult messages to get across, and I think we probably just need to work harder to get that clear to folk.
Right. Just going back to one of Mark's comments. Mark, I'm sure you mentioned that the booking percentage was about 84%.
So just yesterday, so we don't have an awful lot of data to go on, but I just happened to look at this earlier on this afternoon. Just yesterday, our uptake rate was 86%. So 86% of those who were scheduled into Ravenscraig yesterday were vaccinated in Ravenscraig. As I say, that doesn't mean that 14% are just not bothering to turn up. That's on a par with the day-to-day rates that we've had throughout the programme, and yet we still get to 95% for the cohorts that we passed through just now, or up to now rather. So most of those 14% will already have rebooked in somewhere else, either to a local centre or to a different day in Ravenscraig. So I think I would be pretty optimistic that that's just about where we've been up to this point in the programme. Right,
just and follow up on that one then. That 86% is covering the whole of NHS Lanarkshire. So is the bulk of that percentage going to be coming from the central part, i.e. the high populated areas like Motherwell, Adricote Bridge, East Kilbride, etc., etc.?
So that goes back to the point that Heather made earlier on about us looking at this on a very localised basis. And we've asked our own internal IT or e-health department to put together a dashboard to help us to look at exactly this sort of thing, to help us to drill down on individual communities like Kilsyth. Now, I don't have enough data just now to say anything useful about that, because the number of people from Kilsyth yesterday will have been pretty tiny, so we can't really draw any conclusions. But we'll look at that over a period of time. What I would say though is it's not that likely that that's the case. So if I'm saying that that's on a par with the other local centres that we've run up to this point, what it would mean would be that the people from Motherwell and Wishaw, who previously were going to centres in Motherwell and Wishaw, that they were now much more likely to attend Ravenscraig, to counterbalance the effect of people from further afield being less likely. So I think that's probably not that likely. There's undoubtedly going to be some small effect there. I'm not denying that. There will be an effect of distance, that the further away you have to go, the more challenging it is for you, and the more likely you are not to. And that's part of the reason that we've got those local centres in. But I think we probably need to give this a wee bit of time for me to give you a full and honest answer to that once we've seen what the effects of rebooking into those local centres are, Alan. Bill, sorry.
That's a problem with statistics. Yes. Heather Brannan McVeigh, yes.
Thanks very much, Bill. It's something I think that we need to clear up here, and it's regarding the initial use of Garrow Vale. And it's something I've corresponded with the manager about, and I think we need, as this is a Kilsyth focus meeting, I think we need it clarified. I have it in writing from NHS Lanarkshire that says Kilsyth was not interested in using Garrow Vale for vaccines. I do not believe that to be true. I do not believe that the data and how it was handled by the National Centre has enabled you to respond to the people of Kilsyth. Because had vaccinations been available in Kilsyth, they would have got, people of Kilsyth and villages would have gone to Kilsyth. And it seems ludicrous to me that people from Queensbyburn had to go to Christon. You know, I can't actually Garrow Vale. So I think we do need to get a clear and definitive answer on the use of Garrow Vale. And if local centres are grassroots centres in the future, particularly if the response to you will get your second vaccination in the venue of where you received your first, surely there is a need then for the use of Garrow Vale to be used and utilised in the future.
Okay, shall I respond to that, Bill?
Yes,
think, you know, I'm going to put my hands up to this, Heather. This was a mess. Okay, so I'm not going to dispute that point at all. And I think that was probably because we tried to do something after we had put the initial satellite centres in place and after we had, right about the time we were actually starting scheduling. So by that point, we could not actually use Garrow Vale as an initial scheduling centre. We had to add it on as an extra centre that people could rebook into. And again, that was really just about the pace that things were moving round about the start of this programme. We'd asked Public Health Scotland to do an additional analysis for us in terms of public transport times. And, you know, at that point, they were not awful by any manner of means, but at the same time, you could see on the map that they did for us that not so much within Kilsyth itself, but within, you know, Queensbyburn, some of the surrounding villages, there was an issue there, and that was why we wanted to add something extra in. Did we promote that as heavily as we could and maybe should have? No.
No.
So did we actually make the community aware that that facility was there? No, I don't think we did. So, and I think people have rightly said, well, you were relying on people phoning up the national helpline, you know, to be aware of that. So I'm going to put my hands up and say that was something which we could have absolutely done better at. I do want to, this is going to sound like I'm making excuses, maybe even I am. I want to put the context here around this. At that point, we were running 21 centres. We had just started this programme about a fortnight earlier than we had originally intended to do so, to try and accelerate the programme. And things were moving at speed. And what happened essentially was that we were trying to consolidate down across all of our centres, so this wasn't specific to Kilsyth. We were trying to consolidate down days that weren't being fully utilised within centres. So if you're allocating a cohort of people and you've got, say, 700 slots a day in a given centre, you're going to get to a point if you're booking in 700 a day where you don't have 700 people left to book. And that was the way that the cohorts were rolling at that point. So there were across Lanarkshire, particularly in the satellite centres, there were days which were, you know, maybe only had, you know, a sixth or a seventh of their capacity used. So I had then asked our scheduling team to look at all these centres, because in all honesty, we were struggling at that point in terms of the number of centres that we were running. So we were looking to cut down anywhere where we could cut down the number of centres that we were running in parallel on any given day, and to see what we could do where there were small numbers of people to redistribute them elsewhere, maybe increasing the capacity on the preceding days, that kind of thing. And that was essentially what happened in Garrow Vale. So Garrow Vale then got pulled into that. And because probably we hadn't promoted it as much as we could have. And I'm sure you're right that we would have got a better uptake at that point. There were really very few people in Garrowvale across the 2 days that we had allocated. I don't now remember the exact numbers, but it was less than 100 across the 2 days at that point. So what they did was they then went to consolidate those people into 1 day. And they also asked those people, do you want to move, or would it be easier for us to sort out for you to get vaccinated, say, in the same day in Muirfield? So some people moved to the first day and some people then moved over to Muirfield. And that then gave us a cohort which was just about manageable in terms of there being enough people to go and do in Garrowvale in that 1 day. What then happened was we then went to promote it, and it then got swept up because there was such a low capacity with the next round of scheduling in terms of people being booked into that day as well. In all honesty, was the picture around Garrowvale confused? Yes, it absolutely was. And there's no point in me saying that it wasn't. And I think that's something I've just got to take on the chin, and our team would accept. And I can only offer an apology there to people who were given really confusing information, and contradictory information almost. And I had a conversation with Bill about this at the time, that two people were being told things which seemed mutually exclusive on the same day. They were being told that there were no appointments, but they were also being told it was full. Well, essentially at that particular point in time, the day that they phoned, it was essentially the same thing, because what the scheduling team had done was they'd had to freeze all the appointments so that they could move appointments from 1 day to the other without double booking slots. I think the other thing to be honest about here is the scheduling system that we have now is much better than the one that we had 4 or 5 weeks ago. Because again, with everything being brought forward, so the original date that people have been working to for several months in terms of the scheduling system being ready was the 1st of February. And as people will remember, that turned out to be the date that we actually opened all the centres, because the dates were moved forwards by a couple of weeks. So our colleagues in the national team, from about 13th of January is the date that sticks in my mind, thought that they had 3 weeks essentially to finish this nice shiny new tool that they were going to give us to do this, and then basically had about 5 to 7 days to get something that was working, so that by around about the 20th of January we could actually start scheduling for the 1st of February. So, and I'm sure they would have no objection to me saying this, it was clunky, it was really difficult to use. We couldn't use it ourselves. We were relying on our national colleagues to make all these changes for us. So every time we wanted to make a change in schedules, we had to send them an email. We had to then wait for them to make these updates. So it was really difficult to do. And we're in a much better place now than we were, because they have now spent that additional 6 weeks now learning from what they've done and putting in place those changes. And I certainly don't want this to be taken as an indictment on anything that's been done by our national colleagues. They have been working as hard as anybody else. The number of conversations we've had at 11:30 at night, on Teams, or emails that I've got from them at 2 and 3 in the morning. At one point, they had a night shift to make sure that the scheduling happened, when it was supposed to happen, that the letters were getting out in time for people to get their appointments in time. Because we didn't want some of the issues which have happened with previous vaccination campaigns, of people getting their letters late and after their appointments. So everybody has worked really hard on this. Has it been perfect? Absolutely not. Have the residents of Kilsyth come off badly from that around that particular point in time? Yes, and I can only offer my sincere apologies about that. We tried our best. And we did something there that we thought was going to be helpful. And actually, in retrospect, because we went outside what we were doing otherwise within Lanarkshire, it actually caused more confusion and undoubtedly more justified anger about what people were being told, and then what was available not actually matching up to that when people picked up the phone and phoned telephone lines and so on.
Thank you, Mark. Very commendable. You fell on your sword. I think Heather, not our Heather, but CEO Heather, I think in accordance with the current trends now, are you going to resign? That's okay, I'm just joking. Everybody else seems to resign if somebody makes a mistake someplace.
No, what I was going to say, Bill, is, I mean, I think Mark, I think you've been very honest, Mark, and I hope people appreciate that.
Yes.
And what I would say is Mark personally has worked all the hours that God sends to get this thing off the ground. I think this weekend was maybe the first weekend since Christmas, Mark, you've had any time off. So just to say that, he has worked his socks off. I think we're delivering something that's new and is different and is logistically very, very tricky. And have we got it right? No, we haven't got it right, particularly around the communication. And I think that analogy, and I hate the analogy, but it does work here. We're building the plane while we're flying it, and actually we're communicating after we've decided on the navigation chart that we're taking. That's what's happening just now. And I'm really sorry, because it's not the way I would like to work. Normally we would go out and we would consult and engage with communities first. We would have had the conversation with you all. Is there a better venue in Kilsyth? Is there something we can suggest? And we would want to do that going forward, because we're going to have to do this again. This isn't going to be the first time we're going to have to do this. I suspect we'll be back in the autumn with a booster type of vaccination. So if people have got ideas about how we can improve things, we are absolutely keen, to take these on board. So I just wanted, I think Mark's been a bit hard on himself. You've been honest, and that's the right thing to be, but I think you were a wee bit hard on yourself.
Very commendable, thank you. I think I want to try and draw this to a close. I've certainly, in the last couple of days, been wandering about in Kilsyth and and looking at Facebook. Facebook has got its own benefits and its own problems, right? But there's quite a number of people on the local Facebook site saying there's no chance for me to get to Ravenscraig or East Kilbride. I'm not going to bother getting it. And I met on yesterday and today, I met 7 people, and 3 of them were in their early 40s. And unfortunately, okay, it's only 7 people, but that's multiplied up. I said, I'm a driver, but I only drive local. I don't drive on the motorway. I wouldn't even know how to get to Motherwell. Right. And I'm not going to bother getting it. So that's going to be a problem that we're going to have to deal with. The people that have not got the courage or the confidence even to drive themselves there, or to get on a bus and go round the system on the bus, to keep the public transport system. They're not confident. And even these people in the 40s are actually quite scared to leave their area just now. They just really don't want to go out and about, because they've been furloughed for a year, they're working from home, and they've not seen anybody other than maybe their neighbours or their bubble. So they're absolutely scared to go out and about. Yes. The virus and its effect throughout the world has scared them. That's a big problem. I think from our point of view in Kilsyth, we've listened and heard and understand, but we've still not resolved the problem yet of how do we get our community to get vaccinated, willingly get vaccinated. It's hard enough to get them to get vaccinations because of all the scaremongering that goes on with it. Oh, if you get that injection, etc., it's got side effects, and you grow 2 heads and 3 legs and all the rest of it. And then it's getting through to these people. So we have to deal with, and quickly, how we can get our people vaccinated. If that is by opening up the free bus service and having Kilsyth as a base and going through Cumbernauld to Ravenscraig, then that needs to be decided and decided quickly. If in our area in Kilsyth, if we can't have that, then okay, we want Garrow Vale and the health centre used, so that we're kept within Kilsyth. And the worst scenario really is, well, okay, open up Muirfield again or get us to Kirkintilloch, because we've got a bus service that goes there. Right. So we need to deal with this and deal with it very quickly. Before I continue on, Jane, you wanted to say something there.
Yes, thanks, Bill. I just wanted to come in on that point, and we touched on it earlier when we talked about hard to reach communities. And it's in connection with that. I recognise what you're saying. One of the other challenges that we've not touched on in this evening's discussion has been that this has been a national vaccination programme, and it's been guided by not just the national programme from the Scottish Government, by the 4 nations across the UK, and it's been the JCVI committee, the Joint Committee on Vaccine and Immunisation, who developed those cohorts that Mark described earlier. And we have only been permitted to schedule people according to the cohorts that are open in that national programme at any given time. So we have not had the freedom to be able to. I think as we get further into the programme, we will get that permission from the national programme. And I think that's where we need to stay in close communication with you to see if all the things that we've discussed tonight, some of them we might be able to get to work, some of them we won't, but we will do what we can. We do need to look at how we target hard to reach communities, and we will need your help with that to tell us what you feel is the best way to do that. Now, that might be more likely to be a mobile solution than actually a physical centre that opens up for individuals, so that we get even closer to entire communities for a couple of days, for example. But we need to work. That's what I meant about phase 3 and 4 not being described yet. We don't quite know what it is we'll need to do, because we will need to take the learning that we get through this next phase, and also through communicating with all of you about what's right for your communities, because we desperately want to get to a place where more than 90% of the population is vaccinated. And we know that we can only do that by reaching those hard to reach communities, and we will need your help with that and continued communication with you about that. So I hope that helps with that discussion.
Yes, Jane, that would be ideal. And we had great difficulty a couple of years ago. We had in North Lanarkshire Council, and standing joke is in North Lanarkshire Council, you would say, oh, I come from Kilsyth. You got a meeting at Motherwell, I come from Kilsyth. Where the heck's that? So we up in the north of North Lanarkshire, and but we've worked with North Lanarkshire Council, and we have an amazing relationship with them now. It's very, very good. We're in constant communication. They respond, they communicate, and they consult. And we are now a community with elected members' help and what the community has done. We're now recognised in North Lanarkshire as probably, hopefully, one of the most progressive towns and areas within North Lanarkshire. And we don't take no for an answer. We fight for what we want. Yes. And it's paid dividends, both in community confidence, and we've still got a long way to go. We've community confidence in North Lanarkshire now is much better than it was a couple of years ago. And what we've now trying to prevent happening is NHS Lanarkshire getting the same reputation. And unfortunately, NHS Lanarkshire and what's happening in the vaccination programme, quite a number of people are blaming North Lanarkshire Council for it. And North Lanarkshire Council has got nothing to do with it. Right. So it's getting the community to understand who's responsible for what. And I would welcome, and everybody around here will welcome, a close consultation discussion programme. And we don't all need to come to Motherwell or Wishaw or any place like that. We can do it like this and save ourselves an awful lot of time. Is there any more questions to be asked of our colleagues from NHS? Right. Well, I would thank Heather, you and your team for coming and spending the time with us this evening. And it was great to put names, faces to names. It is.
Having us, Bill. Thank you for having us along.
It's our pleasure. And hopefully the next time we meet, we can meet you over a cup of coffee. We've got a good cafe, a good restaurant in Kilsyth. So when that opens up again, a cup of coffee and a hot scone. But thank you everybody for coming, and I look forward to whoever's going to come back to me with all these ideas and how they're going to develop fairly soon. Or I'm afraid, Heather, you've got another epistle. Right, thank you very much indeed for coming, and we'll catch up with you later on. Thank you. Right,
Thank you.
Thank you.
Bye-bye.
Bye.